Diabetes is one of the most dangerous and common diseases in the world. According to the World Health Organization, WHO, about 9% of adult women suffer from this disease, and this number is on the rise. If not well controlled, the disease can cause a series of serious complications affecting the heart, kidneys, eyes, and nerves. It is worth mentioning that women have different manifestations of diabetes compared to men, but are often confused with common health problems. Unlike men, women with diabetes are at a higher risk of endocrine problems, irregular periods, urinary tract infections, or changes in the skin. Did you know that some seemingly normal symptoms such as prolonged fatigue, frequent fungal infections, or changes in the skin can be early warning signs of diabetes? In this article, we will explore 5 common signs of diabetes in women, along with early recognition and effective control measures to help you proactively protect your health. 1. Polycystic ovary syndrome, PCOS. Polycystic ovary syndrome, PCOS, is a common endocrine disorder that affects many women of reproductive age. This condition disrupts the menstrual cycle, increases androgen hormones, male hormones, causes symptoms such as excessive facial hair growth, male pattern hair loss, uncontrollable weight gain, and persistent acne. One of the most serious problems of PCOS is its close association with insulin resistance. When the body does not use insulin effectively, blood sugar rises, increasing the risk of type 2 diabetes. According to research, up to 50 to 70% of women with PCOS also have insulin resistance, making the risk of diabetes 4 to 5 times higher than women without this syndrome. Emma, 30, who lives in New York, has always found it difficult to lose weight despite trying many dieting methods. She often suffers from fatigue, irregular menstruation, and many pimples on her face. After going to the doctor found out that she had PCOS and was at high risk of developing type 2 diabetes. To control this condition, Emma started following a low-sugar diet, prioritizing high-fiber foods, and exercising regularly with gentle cardio exercises. After just a few months, she felt that her body was stronger, her menstrual cycle was stable, and her skin condition improved markedly. If you experience signs such as irregular menstruation, uncontrolled weight gain, heavy hair growth on the face but hair falls out, dark skin on the neck or armpits, go for a health checkup early. PCOS not only affects fertility but also increases the risk of diabetes, cardiovascular disease, and many other health problems. Controlling your diet, exercising regularly, and maintaining a healthy lifestyle can help you improve this condition effectively. 2. Yeast infections. Yeast infections are a common problem in women, often occurring due to an imbalance of bacteria and fungi in the body. However, if you have recurrent yeast infections many times despite proper treatment, it can be a warning sign of high blood sugar levels. Yeast thrives in sugary environments. When blood sugar rises, sugar levels can seep into vaginal secretions, creating favorable conditions for mushrooms to grow stronger than normal. This is why people with high blood sugar or diabetes often experience persistent yeast infections. According to research, women with diabetes have a 2 to 3 times higher risk of yeast infections than the average person. Emma, 29, who lives in London, is regularly infected with yeast despite being very careful to maintain hygiene and follow treatment instructions. She changed the type of hygiene solution, wore cool clothes, but the fungal infection continued to recur. After many treatments but to no avail, she decided to go for a health checkup and found that her blood sugar was higher than normal. The doctor explains that it is the high amount of sugar in the body that facilitates the growth of yeast. When she adjusted her diet, reduced her sugar and starch consumption, and exercised regularly, the yeast infection also gradually decreased and no longer recurred as often as before. If you have multiple recurrent yeast infections for unknown reasons, consider getting your blood glucose tested. Good blood sugar control not only helps prevent yeast infections, but also reduces the risk of diabetes and many other health problems. Adjusting your diet, maintaining a healthy lifestyle, and exercising regularly can help you better protect your health. 3. Changes in the skin. One of the important signs of diabetes that few people pay attention to is acanthosis nigricans, a condition in which the skin in the neck, armpits, and groin becomes darker, thicker, and feels rough. This is not only an aesthetic problem, but also an early warning sign of insulin resistance, one of the main causes of type 2 diabetes. When the body is resistant to insulin, the pancreas must produce more insulin to maintain stable blood sugar levels. This excess insulin stimulates skin cells to grow stronger, leading to discoloration and thickening of certain areas of the skin. According to experts, this condition often appears in the neck, armpits, groin, and even elbows and knees. Jessica, 35, who lives in Sydney, noticed that the skin on her neck was getting darker and rougher. At first, she thought it was due to sun exposure. However, when she went for a health checkup, the doctor diagnosed her with insulin resistance, an early sign of diabetes. After adjusting her diet, reducing carbs and sugar, and exercising regularly, her skin condition improved significantly. If you notice unusual changes in the skin, especially darker, thicker skin in the neck, armpits, groin, or elbow area, don't be subjective. Get your blood glucose checked and assess your risk of insulin resistance. Early detection and lifestyle adjustments can help you manage this condition and prevent diabetes in the first place. 4. Prolonged fatigue. Do you often feel tired even after getting enough sleep? If this condition persists without an obvious cause, it may be a warning sign of diabetes. Normally, the body uses glucose from food for energy, but when you have diabetes or insulin resistance, glucose can't enter your cells as efficiently. This causes blood sugar to rise, but the cells still do not receive enough energy to function, leading to a feeling of sluggishness and prolonged exhaustion. You may feel lifeless throughout the day, even if you are not overworked. Sophia, 38, who lives in Paris, used to think that her fatigue was due to work pressure or a lack of vitamins. Even though she gets enough sleep, she still feels heavy, unmotivated, and always in a sluggish state. She even craved sweets often, but after eating, she still didn't feel more alert. When she went for a checkup, the doctor found that her blood sugar level was higher than normal and diagnosed her with insulin resistance, an early sign of diabetes. After changing her diet, reducing her sugar and starch consumption, increasing green vegetables, and exercising gently every day, she noticed that her energy levels improved significantly and the feeling of fatigue gradually disappeared. If you always feel unexplained fatigue, consider checking your blood glucose. Good blood sugar control not only helps you have more energy, but also helps prevent serious health problems such as type 2 diabetes. A balanced diet, regular exercise, and stress management are key to helping you stay healthy and energized every day. 5. Blurred vision. Have you ever felt your eyes blur for no apparent reason? If this condition occurs frequently, it may be a sign of high blood sugar levels. When blood sugar rises, the body retains more water, causing the lens of the eye to swell. This changes the eye's ability to focus, leading to blurred vision or difficulty seeing clear details. Some people may think that this is a sign of fatigue or common vision problems, but in fact, it may be related to diabetes. Not only does it cause temporary blurred vision, if blood sugar is not well controlled for a long time, more serious complications can occur, such as diabetic retinopathy. This is a condition of damage to blood vessels in the retina, which can lead to permanent vision loss if not detected and treated in time. Elena, 42, who lives in Madrid, began to notice that her vision was blurrier when she drove in the evening. She thought that her eyesight was declining due to age, but after a while, she still felt sore eyes and had difficulty seeing clearly when reading. When she went to the doctor found that her blood sugar level was higher than normal and diagnosed her with prediabetes. Fortunately, thanks to early detection, Elena has changed her diet, exercised regularly, and controlled her blood sugar well. After just a few months, her eyesight improved markedly. If you experience blurred vision without knowing the cause, don't be subjective. Check your blood glucose to detect the risk of diabetes early. Good control of blood sugar levels not only helps protect vision, but also reduces the risk of many other dangerous complications. A healthy diet, regular exercise, and regular checkups will help you maintain healthy bright eyes and protect your health in the long term. If you experience blurred vision without knowing the cause, don't be subjective. Check your blood glucose to detect the risk of diabetes early. Good control of blood sugar levels not only helps protect vision, but also reduces the risk of many other dangerous complications. A healthy diet, regular exercise, and regular checkups will help you maintain healthy bright eyes and protect your health in the long term. 1. Regular health monitoring. If you have signs such as prolonged fatigue, recurrent yeast infections, blurred vision, or changes in your skin, don't skip it. Go for a blood glucose test to detect the risk of diabetes early. Routine testing will help you control your health condition and take timely corrective measures. 2. Maintain a healthy diet. Food plays an important role in controlling blood sugar. Reduce your consumption of sugar, processed starches, and replace them with green vegetables, lean proteins, healthy fats such as olive oil, avocados, and nuts. Eating more fiber-rich foods helps slow down the absorption of sugar, thereby stabilizing blood sugar better. 3. Exercise regularly. Physical activity helps the body use insulin more efficiently, reduce insulin resistance, and maintain stable blood glucose levels. Just by exercising for at least 30 minutes a day, you can significantly reduce your risk of diabetes. Exercises such as brisk walking, yoga, cycling, or swimming are all very healthy. 4. Stress management. Stress can increase the hormone cortisol, causing blood sugar imbalances. Find ways to relax such as meditation, yoga, listening to music, or reading books to reduce stress. Getting enough and quality sleep is also important to help the body recover and maintain stable blood sugar. 5. Form healthy living habits. Besides diet and exercise, you should also limit staying up late, get enough sleep, drink enough water, and avoid sugary drinks. Small but consistent lifestyle changes can make a big difference in diabetes prevention. By adopting these habits, you will not only protect your health from diabetes, but also have a healthier, more energetic body every day. If you have any suspicious signs, don't hesitate to see a doctor for advice and early checkups. Diabetes can cause many dangerous complications, but if detected early and properly controlled, you can completely live a healthy life and prevent serious risks. Pay attention to your body's warning signs such as prolonged fatigue, recurrent yeast infections, skin changes, blurred vision, uncontrollable weight gain. Don't be subjective because it can be a reminder from your health. Taking care of yourself starts with small habits like regular checkups, maintaining a healthy diet, exercising regularly, and managing stress. Making positive lifestyle changes will not only help you prevent diabetes, but it will also lead to a healthy, energetic body every day. Do you experience any of these signs? Please share your thoughts so that we can discuss and support each other to live healthier. If you found this helpful, don't forget to like, share, and subscribe to the YouTube channel so you don't miss out on important health information. Let's spread knowledge together to help people become aware early and better protect their health.